This is Dr. Yemi Famuyiwa, your host of Fertile Talks, and I am happy to invite everyone to Fertile Walk 2025. This is going to take place Saturday, October 18th at 9 a.m. in Rockville, starting from 3202 Tower Oaks Boulevard. So this is more than just a walk. It's a fun, family-friendly day packed with health and fitness coaches, a live fertility and wellness talk, local businesses with interactive booths, and plenty of giveaways and surprises. And as an added bonus, the first 10 people to RSVP will be getting a signed copy of my new book that's coming out in March 2026. It's called The Quest for Fertility. Everyone who registers by March 2026 will also be invited to join our exclusive VIP book club with early book excerpts, bonus fertility tips, and special PDF resources. So, spots are limited. Please RSVP. Go to the link in the show notes and RSVP to save your spot. Can't wait to see you there. This episode of Fertile Talks is sponsored by ILMeds.co, an international mail-order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ILMeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started.
So tonight we have one of our very own again, Dr. Yemi Famuyiwa, our own guru and expert in the area of fertility. And I don't snitch, so I'm going to keep this to myself. There is a surprise.
Yes.
Okay, Dr. Famuyiwa, the floor is yours, and welcome.
Thank you so much. I always enjoy being here. Thank you so much for your warmth and your encouragement. I feel at home here. For Dr. Ajagbe, who's always a support as well, I appreciate you. Thank you. So whenever I have some exciting something that I just crosses my mind, I might call Dr. O and say, just, want to talk about this. And one of the things I wanted to talk today about was mumps, orchitis, and oophoritis. So mumps, everybody knows. For those of Yoruba lineage, you ever heard of Shegede, right? Shegede kwa? It's
Yes,
like,
so
So that's what mumps is. Orchitis refers to inflammation of the testicle. Oophoritis means an inflammation of the ovary. And some people who've been infected with mumps as children may present later on in life with no sperm at all. Very rarely it affects the ovary, but it's not as common as the orchitis part. So that's what that means. So let's talk about what is mumps. Mumps is a virus, is a single-stranded RNA virus, similar to the same virus that causes measles, RSV, rubella, or parainfluenza. And people usually get it from droplets, like somebody sneezes on you, coughs on you, it's inhaled. And once it goes into the body, the first symptoms are like a flu symptom. So weakness and fatigue and maybe a mild fever. And then the prolonged stage, the virus itself can migrate to different organs, not just the genitals. So it can certainly go to the brain. It can go to other organs within the body, the thyroid. It can cause, an encephalitis. It can cause deafness if it goes to the ear. It can cause severe pancreatitis. And the parotitis is what we call, the mumps, shigede in Yoruba. And occasionally we'll go to the testes or even the ovary. There's no cure. It's purely supportive, hydrating the patient and, treating the fevers. So mostly supportive care till it runs its clinical course and they get better. what we're here concerned today is the sequelae, meaning what happens after it's run its course. So, yes, the virus itself can be damaging, but in addition to the virus being damaging, the body kicks up a defense against it. And that defense can be damaging by itself because the body is trying to clean this thing out and it can decide to clean out normal tissue as well. So, what do we refer to the mumps itself? It goes to the salivary glands, the parotid glands, somewhere around here, right on your cheekbone. So when you see infected children, we don't see it much, but if certain countries in Africa, you see it. And they look, with a swollen cheek as if they, like chipmunks, because the parotid gland is swollen and it's inflamed. So that's where the syndrome comes from. So we're not going to talk about the systemic effect of mumps. I'm going to focus on the damage it causes to the reproductive tissue. I don't know if you can see let me see if I can show a pen. Aha, laser. Yay! No, I can't use red. Let's use yellow. Can you see that yellow dot? It's too small.
No, it's too small.
Let's see.
Red may work better.
Okay, I'll try the red again. It was washing out on the red. I'll show you. Okay, you guys see the red I'm moving around. So, mumps, when it affects the testes, this is a picture of the testicles, it does something unique. It doesn't really affect all the cells in the testes. So, in the testicles, just a brief anatomy, the sperm is produced in these coiled tubules called the seminiferous tubules, kind of coiled like spaghetti and really packed on itself. And the sperm produced is collected in what is called the retitestes, which is this jumble of line here, and stored in the epididymis, which is this long comma-like structure. That's where it's stored before it's released. Okay. So in the testicle itself, the sperm is produced by what is called the spermatogonia, the baby germ cells that will make the sperm. So you see it here, this orange area is a baseline, and this fat cell is a baby cell. And these cells are held by this orange big nanny cell called the Sertoli cell that kind of holds everything in place while the development takes place. So what happens is the big baby cells are gradually modified and trimmed as they go through division to reduce their DNA to the mature sperm, which you see down here. And the mature sperm is released into the hollow of the tube. Okay, so this, you only need the Sertoli cell spans the entire layer of production of sperm. This layer makes the blood sperm barrier, so you don't get a mixture of blood and sperm. All right, so the next slide, I'm going to show you what it looks like. Well, this is an inflamed testicle, but I'll come back to that in a second. Let me show you. So these seminiferous tubules, they're coiled, like I showed you, like this spaghetti-like area. And the sperm is gradually made from the baseline. You see these dark cells here, gradually trimmed down to the mature sperm that's now collected in the center. When it gets to the center, it's now funneled off to this epididymis that stores it. But there are surrounding cells, right, that are not part of the cells being produced, right? So pay attention to these surrounding cells and also the Sertoli cells, because mumps has a way of affecting the baby cells, but not the support cells. So the support cells are responsible for making testosterone. So these patients, when infected, may have a normal testosterone because those cells are not damaged. What's damaged is the cells that are producing the sperm. So I'm going to go back once to show you an inflamed testicle. So that epididymis, which we saw in the other slide here, when it's inflamed, it swells and it looks angry. It can be very painful. And the testicle itself expands, a very painful thing, when they have the mumps orchitis. And this is a transient thing. It goes away. All right. So what happens is we talked about the virus getting access to the body, then into the bloodstream, infecting the testes or the ovary, and it destroys the baby cells that I showed you that make the mature cells called the germ cells. So what happens is when you destroy enough of these cells over time, the testicle may actually shrink, right? So these patients go from an inflamed, swollen testicle, and then gradually they may get testicular atrophy to add insult to the injury. The same that happen in the sperm and the testes can actually happen in the ovary, although it's very rare. Now, what percentage of patients who have mumps will get orchitis or have no sperm at all? If it infects only one sperm, one testicle, it's a lower percentage, maybe 20-30%. But if it infects both testes, up to 57% of those may have no sperm later on. And I've picked it up in a few of my patients who came to see me and they're trying to get pregnant with their partner. And we do a semen analysis as part of the basic workup and turn to find out they have zero sperm. And they go, oh, yeah, I remember when I was young, I had this infection, blah, blah, blah. If it infects both testicles, the incidence of azoospermia is higher, although the destruction of the seminifer of the tubules is not uniform. It's not like it wipes everything out. So for those patients, you can actually go do microscopic surgery and look for the tubules that may have not been affected, and you may be able to still find some sperm isolated in parts of the testicle. So it's not, game over. It rarely affects the ovaries, about 5 to 7%. And if it does, it can inflame the fallopian tube and affect the ovaries as well. And I must emphasize, this is rare, right? You don't really see it. But I put it in there for completion's sake because it can happen. So how do you make a diagnosis when they have sperm destruction? Like I said with my other patient, you do a basic semen analysis and you may find either extremely low sperm or no sperm in the ejaculate. Then when you don't find sperm in the ejaculate, we have to now figure out why. Is it because their epididymis is blocked? That could happen. Is it because they have a Y chromosome deletion? That can happen. Or is it because the testicle was destroyed? And you make that diagnosis when they get a testicular biopsy. I have a colleague of mine that does male fertility that I work with who would biopsy this gentleman and tell me if he sees any decent seminiferous tubules and if he sees any sperm in any of them. And he always tells me that if it's done under a microscope, the yield is much higher than just a blind biopsy. For women, you just need to find out, do they have any eggs left, right? So you would do an AMH, which is a hormone produced by the small follicles that are still in the ovaries. So the higher the AMH, the higher the number of eggs left. And then also you would do an ultrasound because we should be able to see some follicular activity at any time, and that's called the antral follicle count. Now, I put this in there just for my public health people. It's preventable. It's preventable by getting the MMR vaccine, right? The measles, mumps, rubella vaccine. And you could see the incidence. The first plot here is in the US. This is over time, like in the 70s, how it was so high. And then when vaccination was becoming prevalent, you saw the incidence go down. So 2 doses of the vaccine provides up to 95% protection against it. And you see some spikes recently in areas where vaccine rate has gone down or the natural immunity in the population has trended down. So I wanted to juxtapose this with a worldwide overview of where vaccines may not be available, such as in some parts of Africa, some parts of Eastern Bloc countries in the Middle East, in South America, where you might still see these full-blown cases, right? I mean, I don't know, Doctor, you've probably seen a few mumps cases or two, right? I'm sure. But if
Actually,
there's
believe it or not, I've not seen a single one in the US.
in the US.
I've not seen one in my practice.
Oh, wow.
And when I was
Lucky you.
younger, I didn't see one. It might have been there.
I grew up in Nigeria, and I do recall seeing people who were infected with it because of that swollen gland.
Yeah.
So, how do you prevent it? Vaccination to protect. People should think about protecting fertility for their kids. So it's not just not wanting to vaccinate, but knowing that lack of vaccination, they'll get over it. It's not like they're going to be sick all the time. They will heal, but then there's a residual damage, and that's what they have to deal with. So that's my little spiel on mumps. The other part that I don't know if everybody can scan this QR code. We are going to have a walkathon, or minor walk really. And if you don't want to walk, you can sit. It's more like a health fair where we're going to have nutritionists, functional medicine people, and maybe some coaches to talk to people about how to incorporate exercise into their lifestyle. So this QR code will take you to the sign up sheet. So if you want to scan that, please join us. It's on October 18 at 9 a.m. And as a bonus, I'll get to what Dr. O was alluding to in a second. So again, this is the QR code. We're going to be raffling prizes to include one free IVF cycle for people who don't have insurance. It won't cover medication. So if you're trying to get IVF and you can buy your own medication and you don't have insurance, this may be your lucky time. And we will also raffle one free egg freezing cycle. But more importantly, I have spent the last 2 years writing a comprehensive compendium on fertility. It's called The Quest for Fertility. And what I have done is use patient stories to educate and inform. Because if I just give you science, it's like me throwing data at you. But when you hear somebody's stories, and I give a little bit of history in there as well, if you hear someone's stories, you might go, oh my gosh, that sounds so like me, or that sounds so like my sister. Now I understand. So the goal is to help people comprehend using stories, but also giving them actionable steps they can take for themselves. In addition, even if you're not doing treatment, how can you protect your fertility? How can you protect the fertility of your children and your grandchildren? Because what you do with your body can affect your children and your grandchildren. So if you come to the walk, you have to be at the walk. You're eligible for signed copies of the book when it comes out, but not if you stay home. So if you want to pre-order the book, this is the QR code for the book. And I welcome group buys too. If you want to buy as a group, there are options there to do that and share with your friends. And the more people that we get to buy with us, the more we can create both an audio book as well as get a hard copy book. So I'll leave you with the two QR codes. The first bigger one is for the walk. If I could get 10 people sign up today, yay! Come for the walk, October 18. Scan that QR code. If you don't want to bother with the walk, but you just want the book, scan the second smaller QR code.
Fantastic. I have scanned both QR codes and they work.
Good.
So scan the QR codes and let's do this. Infertility has become a problem in our community. I don't know why.
Gosh, that's in my book. There's another
That's where I'm going with that.
Yeah, there's a statistic. I'll let you finish your thought. I just want to slip this out. There was a study up to was 2017, several years before. They looked at the fertility decline in the US was 1% a year. After 2017, the decline of fertility has gone to 2% a year. Isn't that scary?
The decline.
Decline. It's declining every year, 2%.
So that's where I'm going. That if you want to find out why, then go for the work, get the book. If you're in California, you may not be able to come for the work. I'm just saying. You're in Nigeria, London, you may not be able to get the book. Not just about you. It's also about our generations to come. It's important that we continue to procreate because we don't want to be extinct. But this is a problem. As a primary care physician, I do referrals. Dr. Famuyiwa is there. Sometimes my patients are close to her and, they can be referred to her, so that they can get, fertility care. I call it fertility. I don't like to use that word infertility, but it is the reality of things. So there are things going on that is causing this. It's the same way we're talking about autism. There are things going on that is causing it. Things just don't happen, and it's important that we find that out. So let's all get educated, get the book. So if you have any questions, as usual, please raise your hand or put it in the chat box. We're going to leave the QR codes on in case of some people that may take their time to scan it. I have a question for you.
Yes.
So when people have mumps, when they
Yes.
infected with mumps, does it automatically infect the testicles also? I know the percentage of ovary infection is very low, like 7%, but does
Right.
it automatically affect them? Or they can just have the mumps and it resolves and we're good?
So I would say the vast majority will resolve without any problem.
Any sequela?
But you might have 20 to 30% that have some issue. And if it happens to infect both testes, that percentage goes up. So, what exactly makes some people get it and others don't? I'm not quite sure. Maybe it's immune related. What's their immunity like? Or is there any co exposure causing it? But not everybody will get it. I've treated two gentlemen right now who we didn't find out till they were grown adults. And they came to me because they weren't getting pregnant. And I do the workup and I have no sperm. And both of them, we did do testicular biopsy. One was a long time ago. So I would say that some of the supplements that we're able to do now, some of the things we're able to do now, the microscopic TESE was not available then, right? So he didn't have a good outcome. They had to use donor sperm. And there are others that we were able to get sperm from them and were able to fertilize their wives' eggs and had successes.
Fantastic. Thank you. Dr. Jagwe, kindly unmute her.
Yeah, thank you. Thank you, Dr. Famuyiwa. Yes, this is one area that has been forgotten as though it never existed. Somehow, our practice overlap because as a pathologist, I diagnosed a lot of mumps.
So you've seen.
Yes, I've seen a lot, even here in the United States. The issue is most of the time we didn't look at the possibility of complications or long-term effects. One of the reasons why I think the incidence of orchitis or oophoritis might be common among Nigerians is because of the folklore. For those who remember or maybe not remember, the antidote that the Yoruba prescribed when I was growing up for anyone who had mumps was to find the nest of a wasp. The wasp nest, which will be clay, they will crush it, they will mix it with water and apply it to the side of their faces where the swelling of the mump was. Of course, since they didn't know how this thing worked, they believed that it was a spiritual matter. The spirits were, annoyed with the individual, and more so that the wasp caused stinging. And the stinging actually, they believe that if they crush the nest of the wasps, the antidote for the stinging of the wasps will actually manage or treat the mumps. It's all about ignorance. And I know that many people will vouch or will actually swear that that thing worked for them. I would say that was more of placebo effect. Anything that people can believe in that can do some wonders will probably do that. Now, the reason I'm raising it up is this. Since most people who have this condition when they were young will never attribute it to anything in the future. it was just like a passing fancy at that moment. It was such a transient situation. And so to imagine that 20 years down the road or 30 years down the road, they will be looking for, sperm or eggs will be totally inconceivable. So I can say now that definitely um, it would not be surprising to find out that a lot of people who never had opportunity of raising children of their own biologically must have been victims of mumps. And because nobody seemed to do a longitudinal study, nobody seemed to follow up on who had mumps and who had infertility in the future, many people are just either being lumped as being unfortunate or household enemies did it or any other attribute they can use to actually justify the occurrence. So I will say that if anybody remembers their history and they're in the childbearing stage and they know that they had mumps at some point, that should be the first thing they would consider when considering, whether they have to have the children of their own biologically or not. Because, like you said, nobody can predict where the mumps will settle and where the side effects or where the complication of the mumps infection will be. So I just wanted to drop that in that a lot of Africans might be suffering from this issue, the complication of mumps in terms of reproductive health.
Yes, I totally agree with you because I've seen it in my practice. And as Dr. O says, it's so rare that even a lot of doctors on this side may not even have encountered that ever, never heard of it. They know about it on an intellectual level, but they've never seen it. The level index of suspicion is not high enough. And so maybe overlooked for a long time.
Yeah, you're absolutely right. And Dr. Jagbe, to your point, mumps is a virus. So when they use the wasps, clay, and all of that, it will go away because what do viruses do? They have their field day and symptoms resolve. Whether you put wasp clay or water or what have you on it, it's going to go away. It's the sequela that is the possible aftermath
Complication.
that is the problem that we're talking about that could then cause this infertility deal. And when a couple have problem having their own child, people usually think it's the woman's fault.
Mm-hmm.
Yeah.
I've never seen in a culture where people even consider men to be the possible one with the problem. They usually think it's the woman. Some men will not even go for testing. And that's another problem. I've seen that. Some men will not go, so you don't know if they have low sperm count or if they have zero sperm, which we call azoospermia, as Dr. Famuyiwa presented. They don't know because they refuse to go to testing. I've talked many into going to tests, and then they find out that they are the problem.
Yeah.
There's a lot we need to learn, and thank God that we are learning them.
Yeah, Dr. Famuyiwa, could you use this opportunity to kind of just allude to STD complications like syphilis?
Wow.
Just segue, just kind of mention briefly.
I was going to ask what STD is.
Sexually transmitted diseases.
Thank you. And now we actually call it STI.
ST infections, yes. And I think that almost deserves its own separate talk because it's so extensive, right?
I
What are we
know.
going to start with? Are we
I
going to
just wanted
start
you to
with?
mention something about it in relation to
Yeah,
complications.
yeah. I mean, for instance, things like syphilis, which can go undiagnosed in some cases, and we in my career seen a lot of tertiary syphilis that was missed until they start having severe symptoms, or even things like herpes that can also affect the uterus, the cervix, the vagina, and things like hepatitis B, that's another quiet one, the antigen, especially when it lingers and then they become a hepatitis B carrier. And maybe infect their partners and get their partners sick. And perhaps also another one, like everybody knows, I have this podcast called Fertile Talks. And it's so funny. I just randomly did some talks on urea plasma, and that is the number one episode till today that everybody is downloading all over the world because urea plasma can be a sexually transmitted infection, but it doesn't really cause symptoms a lot, right? So it's not like you're going to get pus flying everywhere or pain, but it can manifest quietly with infertility or recurrent miscarriages. So when I see patients in my practice, I always screen for ureaplasma and mycoplasma. And if it's positive, I treat both. And patients always ask me, well, who gave it to me or how long have I had it? And I'm like, you don't know how long it's been there. So you don't even know if you gave it to your husband, right? Because
Absolutely.
most people don't get tested.
Mm-hmm.
All right. And if a gynecologist doesn't test it, the only people that might test for it are fertility doctors.
I do
Oh, you do?
routinely. My patients on
Oh,
the platform will tell you urea plasma, urealyticum,
yeah.
mycoplasma.
I'm so proud of you because I
I do
don't find that a lot
routinely.
of doctors do it.
No, doctors don't, but I do
They
routine.
don't.
That yearly physical, that's where even on this platform, I encourage people to do their yearly. That yearly physical, I do STI testings. I don't care if you told me,
Yeah.
you're not having sex because people will not have sex for 2 weeks and they tell me they're not having sex. And ask when was the last time? Oh, 2 weeks ago. And sometimes it's 3 months and they say, so I test routinely. And trichomonas, just for you,
Yes.
I'm able to do that. And I do gonorrhea, chlamydia,
Right.
syphilis, and HIV
Yeah.
routinely.
And with regards to that, you asked me to mention, I mean, those are the big wigs. Chlamydia is really bad because chlamydia can cause an initial infection like the mumps infection, but then it dies and simmers into a low grade thing that patients don't have pain anymore, but the immune reaction to it causes scar tissue and they get blocked fallopian tubes. So it's another cause of tubal infertility. And of course, when you have gonorrhea, you could have a florid PID where you have pus, in the tubes, in the ovaries. When I trained as a resident, one of the hospitals we used to go to, you would see someone's the florid fever, and this was way back when you poke a needle through because they have a bulging cul-de-sac out into the vagina, and pus just flows out, right? And you have to drain the pus as much as you can and stick them on antibiotics for a long time for them to get better. And of course, they heal with a lot of scar tissue. So chlamydia and gonorrhea, if you're planning on having children sometime in the future, you want to make sure, you're tested for these things and treated appropriately, or better still, try to practice safe sex because those can be a cause for infertility again years down the road when people can't get pregnant.
May I introduce one little thing again? Since there is a lot of overlap, do you know that everything you're saying occurs in the mouth and in the
Oh,
throat?
yeah.
So with all this, going on back and forth, somebody might say, I'm not doing any, intercourse, but, I'm still close to somebody, but they don't know whether they are transmitting all these STIs from one area to the other. So all I'm trying to say is that there are many areas of vigilance that we must keep in order for
Yeah.
us to help, patients in the future or even in the present to avoid or to really escape the scourge of, infertility.
So,
Absolutely.
Dr. Ajagbe, what you're really saying is that these things can be transmitted through oral sex. And
Yep.
it needs to be said because some people think that they are protecting themselves by having oral sex and not coitus. So you can transmit these things. I have diagnosed chlamydia in the throat. The patient had gone to the emergency room. They've treated the patient for sore throat, didn't resolve. I said, look, let me culture it because I know the lifestyle. Do you have oral sex? Yes. Okay, let's do this. And it was chlamydia. So, it cannot be stressed enough. Gonorrhea and chlamydia, actually, most of these things are scary because most of the time there is no pain, except for, I was going to say except for herpes, but even herpes, most of the time you don't have pain, especially men. No discharge, no pain. It's more common for women to even, have some kind of symptom. So it's important to get checked, periodically for sexually transmitted diseases. If you are sexually active, and especially if you're not protecting yourself with things like condom, and it's best to have one partner. Stick with your husband or your wife, or, stick with your partner. Like, I treat everything. Women who have sex with women believe sometimes that they can get sexually transmitted disease and that they are fine. So I have to educate them to let them know that you can even contract HIV that doesn't last that long outside of the body. Hepatitis B, hepatitis C lasts at least a week outside of the body. So those are issues too. Herpes, we were talking about testings. Do you know that I do not test for herpes routinely anymore? Whereas, when I was training, when I was in medical school in residency, we diagnose herpes when people come into the emergency room and they have the sores, they have the breakouts in the vaginal or in the private area. It's very painful. They will come to the emergency room. As soon as we say it, we know what it is, but we will culture just to confirm what we already know it is, and we treat it. But then later on in years, we have blood tests that can actually diagnose herpes type 1, type 2. But the problem in clinic is, educating somebody who has never had a breakout to use prophylaxis, 1 pill a day to prevent transmission. Because even though they've never had breakout, they will still, every month, a certain time of the month, they will still be shedding. It's what we call it. They'll be shedding the virus. And when they are in that shedding period, they would infect anyone that they have intercourse with. So they don't know they have herpes type 1 or 2, and they're spreading the joy because they've never had a breakout. The person they infect may now have a breakout. But taking that 1 pill a day will prevent that shedding, to prevent, partners. But that is so difficult to get through to patients sometimes. It is important to test for these things, but more importantly, it is important to have safe sex.
Sometimes we talked about how does your health smell? I gave a talk on that. How does your health smell? One of the ways by which you may suspect something going on in the mouth, which is related to sexually transmitted infection, is the smell. There's a bad breath that comes with that, and most of the time it's because of the suppuration. Pus formation in the back of the throat, and when it dries up, the smell is very foul. So that's one thing that could be suspicious when you get somebody whose breath is always very foul, and they seem to be brushing their teeth. They seem to be trying to be meticulous, but their breath is still stinking. So that might come from the back of the tongue as well as from the throat, which is one area where the infection can hide for a long period of time.
Which
Like you
one?
said, there's no pain. Any of these, bacterial or, infection that can cause, STIs, gonorrhea, syphilis. Syphilis may cause ulcers that are not healing, which way in the back of the throat will be shedding the spirochetes. So those are things that we can bear. They also stink. The breath is bad.
So, Dr. Jagbe, when people come to see you as a dentist and bad breath, or they're complaining of bad breath, would you test for sexually transmitted infections? Because I've never seen a dentist do that. I'm just curious.
Primarily, if you cannot find the direct connection. For instance, I think I've shared on this platform a few times about how the different breath can determine, how certain diseases can present with certain smell. The common smells that we will be expecting in the dental arena will be the smell coming from rotten teeth or, infected gums, which we call, chronic periodontitis, Chronic periodontitis will stink like rotten beef. Like if you forgot beef in your car. Let's say you went grocery shopping and you forgot your beef in the trunk and it's been there for a few days, you start smelling like dead body or some kind of rotten flesh. That is the smell of bad breath. And many times they have bleeding in their mouths, and when the blood breaks down, also adds, a little bit complex tone to the smell. Now, the people that have rotten teeth, it will smell like sewer. I think I've shared that before. If anybody has rotten teeth, all you need to do is get a toothpick. Just stir inside it and smell it. You smell almost exactly like what you smell in a pit latrine. So those are characteristic smells that a dentist will expect for anything that is oral, particularly which is dental related. Now, when it's off of that, there is a smell of the pus that is different. So when you get a smell that is different from this rotten beef or from the pit latrine, you know something else is going on, like somebody who has enlarged tonsils with tonsillolith, that is the stone within the tonsils that is enlarged. The smell from that is incredible. It's unbelievable. Now, we do not, as a dentist, I do not send patients in for STI check because of their bad breath. If I can find the source of the bad breath, they don't have to do that. But many times I ask them the same question you ask them: do they practice oral sex? Particularly if I see signs like condyloma, which is venereal wart. You can see that on the gums. When you see venereal warts on the gums, it's a red flag. Immediately I ask them, have you been, practicing oral sex on a regular basis? Many of them will say yes, they've been doing it. And then I'll tell them, this is what you see in your mouth right now. They have no idea what's in their mouths. Sometimes I find it in the uvula, that is the uvula, which is the soft palate in the back of the throat. When they open, when you ask them to open and you examine the mouth, you see all the venereal warts around the uvula, the soft palate. Those are signs. Immediately I tell them they have to see their infectious disease, practitioners, or if they don't have any, ask them to go see their primary care physician for diagnosis.
Thank you so much for that robust education. I just got insight. Somebody just contacted me that they're driving, and so they can scan the QR codes here for the walk and for the book. So I'm going to ask Dr. Famuyiwa to send it to me so I can forward it to you by text and by email in case you're not able to scan it. Okay? So we want everybody to have opportunity to attend and to purchase the book. So we'll see you there. Question, Dr. Famuyiwa. There's a question here that says, how did you hear about this event, the walk? Through website, friend, newsletter, or advertisement? None of it qualifies for this.
Yeah, I guess you can skip that. I didn't think about that. I
Okay.
will add an
Skip it
other
for the-
to that.
Yeah, I was still actually
Think
able to submit it.
you can still, I think you can skip that part. If it doesn't pertain, you don't have to fill it out.
Okay, cool. Cool. It's very easy. They just few questions to register for the walk, and the book as the video. You can learn some things and assist in raising funds to also help this person that is going to get a free IVF. Thank you for doing that. Thank you.
Thank you so much. I appreciate it. So I'm going to look forward to seeing you guys. Please, when you RSVP, let me know. We're going to be, and another thing, once we get started, I'll probably reach out or just order blanket t-shirt sizes, but we will be having t-shirts. So I think most people will probably be medium and a large.
Oh, well. It depends on how medium or large, because, well, I think medium and large will work, I think.
Yeah.
Or you may want to include it in that few questions.
Yeah.
So before you send me the QR code, please include that. So,
Yeah.
where's the walk going to be?
It's going to start in front of my office, 3202 Tower Oaks Boulevard. And really, we're going to have a really baby walk, which is really just around the parking lot, really. for those that don't want to go
Come
anywhere.
on.
And then there's going to be a longer walk. The longer walk will go into the neighborhood, but it will start there and end there. And my intention is to get some athletic coaches to lead us through warm ups and stretches and cool down exercises before and after. And for any physician in the webinar tonight, if you want to showcase your practice, then you're welcome to be a sponsor, in which case we would ask that you give us a print ready ad. So when we make the flyer for the walk, we can stick it in there and you will be eligible to, yeah, it's going to be a BYOT, bring your own table. If you want a table with a chair, bring your own table and chair, only if you're a sponsor.
Nice.
Or bring your own booth, yes, BYOB, yeah.
Nice. Thank you so much. And thank you for all you have done in this quest.
Thank you.
Thank you. We appreciate you for all you're doing in the community. We want to be having children. We want those babies. Come on.
Yeah, oh my gosh. At the rate fertility is going, the human race is going to be extinct if they don't do something about it.
That's why we have you. And
Yeah.
people like you in this realm, so that you dig deeper into more courses. Now we know about moms, and there's a question. Let me ask you that question. We know that the possibility of complication of moms is this lack of sperm later on, where it could affect the egg later on.
Right.
If somebody contracts moms, first of all, everybody should get vaccinated, and mothers vaccinate their children. That's the first step of prevention. When you get the MMR vaccine, your chances of getting mumps is close to nil. So say it happens, somebody gets mumps. Is there anything they can do to prevent the complication, the sequela?
Really, honestly, when they get mumps, there's nothing you can do, right? You're just giving supportive care. Maybe some of the newer antivirals might work. I'm not sure, but there's almost nothing you can do. So you almost have to kind of ride it out and see what happens.
To get the vaccine.
Prevention is really the cure.
Prevention is the way to go. So I have a question here. How do you differentiate a woman's monthly pheromone smell, from STI disease smell?
It depends on where the infection is, right? You just heard Dr. Ajagbe give a whole lecture on the different types of smell from the mouth.
No, I think it's talking about when women are menstruating.
Yeah, I
Women
mean,
have
you don't
this
really, yeah, that's just blood, right? The only STI that really gives us off an odor in women that much is bacterial vaginosis, right? So you have that fishy odor smell that may get worse after sex because the semen, the alkaline sperm releases the smell from the bacteria, that gives a fishy odor smell. Apart from that, you're not really going to smell chlamydia or gonorrhea per se. If people are floridly infected, they're in pain. We call it the STD shuffle. They can't walk. They kind of walk over, hunched and shuffle forward because they're in pain. They can't stand up straight.
Yeah, that's true. Fishy odor is different from the smell of menstrual blood. And there's another thing that may smell. It may, but it's not a sexually transmitted disease. Yeast infection, candida in the vaginal area, it can smell, but it's not the distinct smell of menstrual blood. And that one is not sexually transmitted also. Excellent question. Thank you for asking. Not all smells are STI, but do your routine checks. If you feel uncomfortable, you suspect that it's possible that you have had exposure to an STI, get checked. Go to your primary care doctor and let them know that you would like to get checked to rule out an infection. They'll do it. They'll do the testing. So if there are no more questions, Dr. Famuyiwa, I'm yielding back to you to give us
Thank you so much.
your remarks. Let us know what we should take home with us.
Take home prevention, prevention, prevention. And also, the other take home is awareness. I think they just assume that everything is going to be okay till it's not okay. And that has always been my life mission, is to provide education. And that's really why I think writing this book is probably one of the hardest thing I've ever done. When I naively started writing it, had no clue how hard it was to write a book. No clue. It has consumed my life for the past 1 year. So I really poured a lot of heart and soul into it because I want people to be able to relate to it and to see what they can do. And now that we know that whatever affects your fertility can be transmitted to your children and even your grandchildren. So, or even if you have children now and you think, well, I don't care, I already have my kids. Well, will they have their own kids, right? Will they be able to procreate? Will their children be able to have grandchildren? So I think awareness, which translates into changing some things that we are doing now, is key, right? It's key. The same way that years ago, there was a lot of information about smoking not being good for lungs. And now we see smoking rate in America is one of the lowest it's ever been, right? But you go to some third world countries and they're still puffing it up like, no man's business. So with awareness comes change, right? And now that we keep saying it over and over like a broken record, change starts with us, right? We make those changes, we decide. One of the things I talk in my book about the things that your body is exposed to that could affect your fertility. I'll give you a quick example and then I'll be quiet. For instance, I always tell patients to look at their makeup, look at their deodorant. Does it have aluminum in it? Because we know that that can be a contaminant. Well, guess what? Now that more and more patients have been educated about the harm of aluminum in deodorants, did you see when you go to the grocery store or any pharmacy, you look at the deodorant shelf, and the first thing you see plastered all over it is aluminum free. They didn't start making it because they wanted to. They started making it because people voted with their pocketbook and saying, I'm not buying this toxin anymore. So when it sits on the shelf, it sends a message back to the manufacturer. So there are a lot more things in the book that I also mention that can affect your fertility that I want you guys to start voting with your pocketbook. So we're not going to be investing in these toxins anymore. And the corporate world only listens to dollar signs. And when people start voting with their wallet, you will start to see a change. And that's why I wrote that book. And also, I think, for the Fertile Walk, I think it's fun. Just come out. You're going to meet a lot of people, talk to a lot of people. You might even run into Dr. O there and other doctors, coaches. And I think that if you come out in a social setting, you'll realize that, gee, there are other people trying to navigate this as well. So that social support is important. Come out and hear what we have to say. What do you have to lose, right?
Thank you so much. I agree. See you there.
Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.